So as we were talking about in our last half hour, when it comes to healthcare, we know that access to screening and life-saving treatment is not always equal. There are many barriers, including stigma. Data from the U.S. shows Black women have the highest rate of death due to breast cancer, despite having a lower incidence of the disease as compared to white women. So this is something Dr. Doreen Ezeife has seen all too often. She's a medical oncologist at the Tom Baker Cancer Center in Calgary. Thanks for joining us this morning.
Thank you, Anne-Marie. It's a pleasure to be here.
Let's talk about these numbers. Why are some Black patients hesitant about cancer screening programs, and what effects do you see of that in your practice?
Yeah, so we know that Black patients are faced with additional barriers when it comes to cancer screening. And there's cultural reasons for this, and there's also historical reasons for this. Studies have shown that in Canada, for Black female immigrants, for example, they're more hesitant to adopt cervical cancer screening because they cite reasons like not having a regular family physician and not having a female family physician in particular. For other Black patients, there's that medical system mistrust. That's another reason that they cite for not adopting cancer screening programs. And this is something that increasing the representation of Black healthcare providers can help to combat.
Last hour, we spoke to the founders of the African Cancer Support Group. They explained a little bit of their story and why cancer support like this is so important. So what difference do you see that it makes for patients?
Oh, it makes a tremendous difference. You know, we cannot journey through cancer alone. Cancer patients need that support network. They really do. That support network allows them a group of people to share experiences with, share their cancer journey with. And what happens is that they also start to exchange information with the other patients and to discuss about the treatments they're receiving and what they can expect for people who are at different parts of their cancer journey. And, you know, for example, just last week, I had a patient ask me about clinical trials, and she was told by one of the members in her support group to ask me about clinical trials. So that's why she brought it up to me. So what we're finding then is that when we have cultural support groups like the African Cancer Support Group, what that really does is it empowers our Black patients to seek out that information and to communicate more effectively with their healthcare providers.
You know, we started off this interview with American numbers, and part of that reason is because Canadian registries don't collect race-based data, even though other countries do it, like the U.S. and the U.K. Give us some reasons. Why should Canada be paying attention to this, and why should we start to collect it?
Race-based data is so important. It helps us realize what our needs are and really identify those gaps. You know, there are some studies that have been done in Canada, and there are very few of them, because as you said, we don't collect race-based data. But the few studies that have been done by linking census data to cancer registry data, they've shown that Black cancer patients experience higher mortality in breast cancer, similar to what you showed in the US, in prostate cancer, in pancreatic cancer, and also in colorectal cancer. So we know that there are gaps that exist, and we don't know the reasons for this. Is it because of access to screening? Is it because of access to clinical trials, access to stem cell transplants? Do we need to increase education? Really getting race-based data, collecting that race-based data routinely can help us to identify what the gaps are and design targeted interventions to close those gaps and really achieve equity in cancer care.
Dr. Doreen Ezeife, thank you so much for joining us this morning. Great interview.
It's been a pleasure. Thank you, Anne-Marie. Have a great day.
Hey, thanks for watching. If you liked this, be sure to subscribe here, or you can check out more Your Morning videos right here.